worries. I only gave. I mean,
अभी आपने भेजा ना, मैंने अभी देखा
हाँ हाँ
इनफैक्ट
हाँ, कोई बात नहीं. We can discuss
but we
that.
can add all those
Yeah,
suggestions.
yeah. No worries, no worries.
I request all the panelists to please mute yourself for next 2 minutes.
Okay.
No worries. I only gave.
So Rajiv, it is live.
Yes, sir. We are
And
live now.
welcome Aditi ji or Mr. Chandrabhushan. He has also joined. So welcome you.
Thank you.
Aditi ji, are you with us? So Rajiv, I think you can start now. No?
Yes, sir. Good afternoon, one and all. I, Mr. Rajiv, working as a project coordinator in Advancing Tobacco Control Project at Department of Community Medicine School of Public Health, PGI, Chandigarh, would like to welcome you all, Department of Community Medicine, Strategic Institute of Public Health Education and Research, CIPHER, and the Union Southeast Asia Region Office, India, for this important consultation on tobacco product waste and health and environmental impact. Protecting environment from tobacco waste as a tobacco product waste has received a little attention despite post-consumption litter produced by approximate 6.3 trillion cigarettes smoked globally every year, including some 300 billion cigarette packs that produce an estimate 18 lakh ton of waste paper, cell phone, foil, and glue, the trillion of cigarette butts that are littered on roadways, pavements, and in park and other green spaces. Keeping in fact, we have organized this important consultation to bring the issue to limelight, not taking much time of your. Now I would like to welcome Dr. Rakesh Gupta to move forward with the agenda. Dr. Rakesh Gupta is President and Director, Public Health, Strategic Institute for Public Health Education and Research, CIPHER. Sir has formerly a Director Health Services and Director Chemical Examiner Lab, Punjab. Sir, alumni of John Hopkins School of Public Health, Baltimore, 2012, and University of California, San Francisco, 2012 as a short-term scholar. Sir has a award of WHO 2015 World No Tobacco Day, and Sir also represent Ministry of Health and Family Welfare for consultation in Panama 2016. Sir represent Ministry for consultation in Geneva 2017, and Sir has an award of explanatory services in medical profession by SPI 2019. I welcome you, sir, Dr. Rakesh Gupta, sir. Over to you.
Thank you, Rajiv, for the introduction. So, welcome you all. Next. So, we actually coincided this national consultation with our 6th Punjab State No Tobacco Day. So, Punjab is one of the states, very few states, who are celebrating a separate No Tobacco Day along with the World No Tobacco Day on 31st May. So the theme this year is let us make our workplaces tobacco free. Next. So good afternoon and welcome to the National Consultation on Tobacco Product Waste, its health and environmental impact. CIPHER, E-Resource Center for Tobacco Control, Global Health Advocacy Incubator, Union Southeast Asia. We are more than honored to organize this webinar that would highlight effective ways to protecting health and environment from tobacco product waste. At the outset, I would like to share the concerns of Dr. Meera Agi. She is a behavioral scientist of international repute. Presently, she's in US, and because of the timing, she could not join us. She says that discarded cigarette butts, they are a major source of water pollution. The main reason for smoking's impact on the ocean is due to irresponsible disposal of cigarette butts. Hardly do smokers realize that butt litter pollutes our waters. It is a neglected human right likely to affect and damage both physical and mental health. Starting from public education, regulatory measures should be urgently launched to save our waters. Smokers not only violate the rights of the people by subjecting them to the smoke, but they also pollute the water they drink and cook with. So, violating human rights in any way is the most serious crime, according to legal experts dealing with human rights. Next. So I'm delighted to welcome all the esteemed experts who took time from their busy schedule to be part of this important consultation. And I would first like to welcome the guest of honor for the consultation, Mr. C.D. Singh. He is IFS, Additional Principal Conservator of Forests, Ministry of Environment, Forest and Climate Change, Regional Office, Chandigarh. I would also like to welcome Ms. Aditi Tandon, Special Correspondent, the Tribune, who actually motivated us to have a discussion on this issue after she highlighted it in the Tribune. Dr. Amit Yadav, he is Senior Technical Advisor, Tobacco Control, the Union Southeast Asia. I'll also like to welcome Mr. Chandrabhushan, President and CEO of iForest, Dr. Jagdish Kaur, Regional Advisor, Tobacco Free Initiative, WHO Regional Office for Southeast Asia, Professor Dr. Pankaj Chaturvedi, Deputy Director, Tata Memorial Center, and HOD Department of Head and Neck Surgery, TMH, Mumbai, Dr. PC Gupta, he is Director of HELIS, Mumbai, Dr. Ravindra Khewal, Additional Professor, Department of Community Medicine and School of Public Health, PGI, Professor Dr. Sonu Goyal, PGI MER, and Mr. Arun Verma, Director of Finance and Operations to the consultation. And I also welcome all the participants who are there on YouTube. So now I'd like to request Dr. Sonu Goyal to give an introduction to the subject. So Dr. Sonu Goyal, he is Director RCTC Chandigarh, and he is Professor in Department of Community Medicine and School of Public Health. He has got 17 years of rich experience in public health and health management. He is an alumni of Johns Hopkins School of Public Health. He has been awarded Public Health Excellence of India by Honorable Union Minister of Health and Family Welfare in 2014. He is Program Director for International Public Health Management Development Program sponsored by Ministry of External Affairs. So over to Dr. Sonu Goyal.
Thank you, Dr. Rakesh, for a very generous introduction. And very good morning and good afternoon to all our panelists, speakers, experts, as well as our audience. So Dr. Rakesh Gupta has very aptly introduced the topic, and he has also told that topic is really very useful in the present context and very novel idea to be discussed among the public health fraternity. So as everybody of us is aware that tobacco is one of the greatest noxious product which ever has been there on the earth. It has lot many bad effects. Everybody knows, most of us knows that it kills around 13 or 14 lakh people every year, as well as lot of diseases. You start from head to toe. There are n number of cancers which are attributed to the tobacco use, and there has been a lot of research which has been suggested that tobacco is a greatest killer, a public health killer, as well as a very bad product on this earth. The good thing about tobacco is that this is one of the risk factor which can be controlled. There can be, it is a modifiable risk factor. This means that we can have we can control tobacco use. So now even the tobacco is not only harmful for human but also for animal, for environment, be it water, soil, or any other environmental thing which we can think of. Now if we think about the cigarette and tobacco product waste, which normally are like cigarette butts and even the wrappers, which is there. So this is harming our environment. We have traditionally focused upon the tobacco smoke, which is harmful actively to the smoker as well as to the second-hand smokers. But uh, we have not gained that attention on the tobacco product waste, which is now polluting our air, water, and other resources. Now, tobacco product waste contain all type of toxins, whether it is nicotine and carcinogens, which is present in the tobacco products, along with that plastic thing which is there in the wrapper, which is non-biodegradable, as well as the non-biodegradable filter, which is there, which is attached to most of these cigarettes, which add to the toxicity. And the toxicity studies, various toxicity studies have shown that the tobacco which get leached from these butts or cigarette butts in the water are very toxic, not only to the water, but also the microorganism which are present in the water, and like fish and all the organisms which are there in the water. And this toxic chemicals can also be identified in the roadside tobacco product waste. And so this means that the tobacco product waste is really very harmful. And as Mr. Raji has pointed out, that it is produced by approximately 6.3 trillion cigarettes, which is smoked globally every year, and 300 billion cigarette packs. So you can imagine the amount of tobacco waste which is being produced. And so that's why this consultation is. So I think it is just an introduction of the topic, but in the next 1.5 hour, we shall be discussing about the harmful impact on the product, and we'll be making a few recommendations out of this particular webinar after discussing the topic with the subject experts, and we'll be submitting this recommendation to the relevant ministries and relevant stakeholders. So I again welcome you all for this particular important consultation, and we will like to hear more about this interesting topic from our panelists. So over to Dr. Rakesh Gupta. Dr. Rakesh, can you?
Okay, thank you, Dr. Sonu, for the introduction. And I'll now like to welcome Dr. Rana Jay Singh for an overview of the issue. He is the Deputy Regional Director, Tobacco and NCD Control at International Union Against Tuberculosis and Lung Diseases, New Delhi. He is a medical doctor with MD in pulmonary medicine and 25 years of experience in public health, focusing on management of tobacco control, management and tobacco control. So he's a master trainer of courses for mid and senior level managers and currently supporting tobacco and NCD control programs in Southeast Asia region. So over to Dr. Rana Jay Singh for an overview.
So thank you, Dr. Rakesh. So first of all, can you hear me?
Yes, you are audible. Yeah.
Okay, thank you. So good morning to all of you, respected dignitaries of today's consultation. First of all, thanks for your time during this current COVID-19 situation. And while it is weekend today, as Sunday, you see, I am primarily a chest physician, uh, working for the last many years in tuberculosis control, tobacco, non-communicable diseases, and other lung health issues. In tobacco control, as you are aware, we already have policies and laws, along with many other interventions are done, like awareness generation, tobacco association, that is helping people to quit tobacco use, and other interventions like youth involvements. Why basically I am sharing this with this group, because there are people here in this group, in addition to those who are working in tobacco control, that before actually we go for this discussion, we need to understand and that how far we want to go. As far as you see, currently we are dealing with tobacco control with a public health perspective. We are undertaking many such activities. Along with that, we have laws, policies for various issues related to tobacco control. Now, this is something, a new area, a new approach, whether it is primarily for environment control or it is primarily for overall tobacco control. So, how far we want to go for all these issues? You see, in last now almost 7 months into COVID situation, what we have seen, not here in India alone, but globally, that despite the global slowdown, whether it is travel, whether it is tourism, whether it is hotels, restaurant business, whether it is retail business, there is a big slowdown globally. But you see, tobacco industry has not got uh, been affected. They have done exceedingly well in this situation also. And during this period also, they try to promote their name as well as their products. They try to get access to the policymakers through their various CSR activities. So, in other ways, that despite that this scenario, they try to promote their product. Despite the fact that we are aware that tobacco use, both in the form of smoking or smokeless tobacco, that harms, that leads to increased infection because of COVID, as well as increased or maybe more severe disease among those who are affected by COVID infection. So then how we can stop in that way? So what we are trying that while we have policies, we need to adopt, we need to continuously work on all such issues through which we can squeeze all those tobacco industry activities, as well as this huge burden which has been put on the environment by use of various tobacco products. So now, very quickly, I will take you to the problem and what is the current status currently in our country as far as tobacco product waste is concerned. So very quickly, my slide, please. Saurabh.
Yes, sir, it is visible.
No. Yes, please move. It's not there.
The slide is visible to everyone.
Yes. Let me see. Yes. So please come to the first slide. Yes. So you see, India's tobacco control problem is complex, much different from in the country in the West or other countries globally. So we have variety of tobacco use, and definitely cigarette is one component. And if we find that what kind of litter is produced by cigarettes, so cigarette butts and filters, which you are aware are made of cellulose acetate, a kind of plastic. Then there is a paper or rayon wrapping which is done for that portion of cigarette butt. Then we have unburned or remnant tobacco. Then we have a wrapper or a foil in which all the cigarettes are wrapped. Then we have empty pack. Then we have sometimes advertisement promotion insert. Within the pack, there are advertisement inserts. Then we have related items which promote smoking in the form of lighter and matchbox. Next, please. And then if we find other areas, BD. So what kind of litter is being produced by BD? It is BD ends and definitely unburned BD and their wrappers. And as you are aware that BD comes in various forms. It comes in the form of a bundle also, which is wrapped in a paper. And it also comes in the form of a plastic pouches. So now many BDs, 20 BDs are there in a plastic pouch. Then, as far as smokeless tobacco is concerned, we have packaging, plastic packaging, both for retail and wholesale packets. So there are big packets. They also are in the form of a plastic pouches. There are plastic boxes, and also we have tin box, tin packs, as far as smokeless tobacco is concerned. Then a new kind of waste, which is now likely to be generated if we do not do anything, that is e-cigarette waste. And various kind of waste which is there is e-cigarette in the form of pods, where they are packaged, empty nicotine cartridges, metal or steel body, battery, and various kind of electronic circuits or electronic material is there. So tobacco product waste from above products are the most common items which is picked up in cleans up worldwide, if we see, and cigarette is definitely a major portion of that also. Next, please. So these are the few pictures which you see every day around you. Next, please. So this is again the plastic pouches from smokeless tobacco. Next, please. This is something from electronic waste, so many batteries, steel and metal bodies, glass bodies, then e-cigarette ports, plastic casing, plastic pouches. So that's all is coming up as a new waste. Next, please. And so perhaps it is number one source of waste as far as number is concerned. And above all, it is non-biodegradable. Cigarette butts, which constitute almost 25 to 50% of all collector litters. You see, once now we are going through that, we exactly know the burden, that how big burden is from tobacco use or tobacco consumption globally. So we will also go, as mentioned earlier also, in India, we manufacture about 1.3 trillion cigarettes, 1.3 trillion BDs, and about 100 to 150 billion cigarettes. And out of that, 100 billion cigarettes are dumped into our environment every year. Because currently in our country, we don't have any kind of specific policy as to deal with this burden. Next, please. And now various studies. Definitely, I would like to share with you that cigarette litter comprises largest percentage globally, which leads from 19 to 38% of total waste, which is collected globally and during coastal cleans up each year. And various toxicity studies which have been done, they suggest that compounds which leached from cigarette butts in salt and fresh water are toxic to aquatic animals and test fish. And also a study from San Diego State University that states that one smoked cigarette butt in a single liter of water, if a butt is placed in a single liter of water, it is then there is oozing out of leaching of different chemicals in that water, and that is sufficient to kill marine and freshwater fish. Next, please. So these are a few beautiful depictions of what we have already said, Dr. Gupta and Dr. Sonu, Rajiv, that there are many chemicals in that, how they are affecting various environment. So these are few awareness generation material prepared globally. So these are pictures from US. Next, please. And you can say cigarette butts which contain all kinds of chemicals, carcinogenics. So they are really very harmful. And these chemicals remain in water for up to almost and soil up to 10 years. So very long life is there. Next, please. Yes, next, please. Next. So this is the overall, you can see the possible pathway for human health risk due to tobacco product waste. I think this has already been said. Next, please. So why this letter? So this is again, while we are now discussing what should be our strategy, so we also need to understand why this letter. Who is responsible for this letter? Is it only tobacco industry, or is it a behavior or a norm issue also? So one of the study from New Zealand by Patel and others that shows that this behavior of throwing cigarette butts here and there is perhaps a norm. People open their window while they are traveling in a car or a bus and throw that out. So perhaps it is a behavior. So do we need to change the behavior? Even if they have found that even if there were dustbins and other receptacles for waste management. So people were not using them. Similarly, another study, which is basically perhaps it is a tobacco industry sponsored study, Keep Britain Tidy, which estimated that 43% increase in number of littered cigarettes attributed to a ban on indoor smoking. So they are putting the blame that while there are smoke-free policies, while we are banning smoking at public places, perhaps people are coming out and they are now throwing cigarette outside, and that is why. So they are trying to undermine. So they are tobacco industry sponsored group, and they are trying to undermine smoke-free policies where there should not be any smoking at public places. So we should all be ready while we are developing our whole plan. What will be our whole strategy for control of this litter? So what kind of behavior change is required for this? Next, please. So already I think environmental toxicity study. So we have environmentalists among us, but several studies now have shown chemicals that leach from cigarette butts can be acutely toxic to aquatic organism as well as to human health. And you can see the whole number of list which we used to say 7,000 chemicals in tobacco products. So whole list is also present in these chemicals in this waste, and that can also harm uh, all health as well as our environment. Next, please. So now, what is the issue? First of all, filter tips are non-biodegradable. Preliminary research globally also indicates that toxicity of tobacco product waste to a variety of aquatic organisms, human health, and other animals or birds which are exposed to them. The filter tip is an important product source of environment contamination. So these findings strengthen the evidence base for taking action on this environment globally. But please see the last line. Tobacco industry's effort is to continue to avoid the responsibility that tobacco product waste lead to environment contamination. So they are not agreeing to that part. So they also do not agree that any kind of intervention is required in this regard. Next, please. So now, what is the status in our country? So first, I will take you to very quickly to our plastic the waste. So as you are aware that smokeless tobacco like gutka, flavored and non-flavored chewing tobacco products, and pan masala, they have plastic packaging, which is a major source of plastic waste in India. In 2010, Supreme Court had asked, please see what has happened despite all these issues. Supreme Court of India asked all gutka, tobacco and pan masala manufacturers not to use plastic material in packaging in 2010. Then again, nothing was done. In 2011, a contempt petition was filed as not following the apex court order amounted to disobedience. Then again, apex court then directed the environment ministry. First they directed them, then they directly directed environment ministry and other agencies concerned to ensure implementation of its order across the country. So please see, although it's a plastic waste, but these orders were specifically for tobacco product waste. Next, please. Then in 2016, Environment Ministry came up with plastic management, waste management rules. You are all aware under EPA 1986 to tackle the problem. And these rules again asked tobacco industry not to use plastic in any form for packaging, storing, or selling gutka, tobacco, and pan masala. So this also includes other products in addition to pure plastic. It also includes other related material which is used for packaging like vinyl acetate, malic acid, vinyl chloride, copolymers. So the order also covered that part. But what is the status of enforcement? So you are all aware, and I think now we have experts here. So they will also share the status what is the current status of this order. Next, please. So now, finally, I would say that tobacco product waste is environmentally hazardous and significant community nuisance. multi-pronged strategy is required, and I think we are all here but first definitely it's increase public awareness about toxicity and other environmental impact of tobacco product waste. And now when we have no NGT order specifically to work on this issue, it's good that because it's not only public health advocates or people like me who are involved in tobacco control and many other stalwarts who are here. So ultimately we wish tobacco control. We wish how we can put and squeeze tobacco industry from all sides. So here it's good that environmental advocates and they should join hands with tobacco control advocates to highlight the issue to policymakers. We also need to think whether in countries like ours, whether in countries like India, extended producer responsibility principle EPR, whether it is applicable and what needs to be done in to ensure that to put liability and responsibility on the producer. We also need to ensure other measures like labeling cigarette packages, that is whether we need to provide additional instruction for the users on the packet for safe disposal of buds. So this is another part. Already we have pack warning. They were basically to inform them about health. Now, what about disposal of that packet? So then other things which are also being discussed globally are issues like cost recovery for cleans up operations and services. Then litigation for environmental damages they are also happening globally. So in fact, this is just to highlight what are the main issues which we need to discuss in today's consultation, and how far we should need to go to get maximum benefits out of this consultation. We would also like to hear from experts. Now there are 3 months has been given by NGT to environment to Central Pollution Control Board for those rules. So what is the current status of those rules as on today? Next, please. So thank you very much. I think I am not an expert. Definitely, I will be part of this consultation, but we have now experts on all aspects of tobacco product waste. Also, I think they will be happy to answer and discuss all these issues. So thank you, Dr. Gupta ji. Thank you very much.
Thank you, Dr. Rana, for letting us know about the magnitude of the problem. And so we have with us very eminent panelists, and Ms. Aditi Tandon. She's a special correspondent, the Tribune in New Delhi Bureau. She has 22 years of reporting experience in politics, development, gender, arts, culture, and lifestyle. And she has authored a range of special research articles on development issues, including health, education, gender issues. She's winner of the UNFPA Lardli Media Award, commendation by the jury of Chameli Devi Award for Outstanding Women Journalist 2007-8, and was awarded the British Scholarship 2005-2006. She has been awarded commendation by the Independent UK for meaningful contribution to the newspaper. And she has held interviews with celebrities from the world of classical music, dance, films, theaters, health, education, with dignitaries, professionals, including architect Sabdi, Assistant Director General UNESCO, Iranian Ambassador to India. And she is the one who initiated into holding this consultation. So welcome, Madam Aditi Tandon. Next.
So we have Dr. Amit Yadav with us, who is the Senior Technical Advisor at International Union Against TB and Lung Diseases, New Delhi. He is a postdoc scholar from Center for Tobacco Control Research and Education, University of California, San Francisco, USA. He is a doctorate in law from National Law School of India, University, Bangalore. He is an alumni of Johns Hopkins, Baltimore, and National Cancer Institute and America University of Beirut in Lebanon. He has worked with a lot of organizations, including Hridaya, New Delhi, Public Health Foundation of India, WHO, New Delhi, WHO FCTC Global Knowledge Hub on smokeless tobacco products. and he was also an elected member of Board of Directors of the Framework Convention Alliance, representing Southeast Asia Region Office for 2016 to 2019. So he'll be our legal expert for answering few questions on legal issues pertaining to tobacco product waste.
Next. So Mr. Chandrabhushan, he's a environmentalist of international repute. He is the president and CEO of the International Forum for Environment, Sustainability and Technology. He was a deputy director of Center for Science and Environment during 2010 to 2019. He has researched, written, and campaigned for issues ranging from climate change and energy transformation to rights of mining affected people and industrial pollution. He has authored and co-authored 20 books and co-authored, directed more than 60 reports. He has led 20 independent scientific studies on food safety and environmental pollution that have catalyzed significant improvements in the food safety and environment regulations of the country. And we had a very good article in Dainik Bhaskar today from him regarding air pollution. So next. Next. So Saurav, I think some of the panelists are there. Can you share the screen? Yeah, after this? Yeah.
So it is my proud privilege to welcome Dr. Pankaj Chaturvedi, who is head and neck cancer surgeon of repute and deputy director at Tata Memorial Center, Mumbai. And he is the visiting faculty to many institutes and almost 44 institutions in 32 countries. He is the editor of textbook of head and neck surgery and associate editor of an international journal of head and neck surgery. Authored 200 plus papers in international peer-reviewed journal and received several awards. Some of them includes Excellence in Cancer Care in 2017, Nana Palkar Smriti Award for Excellence in Patient Care in 2017, Judy Wilkenfeld Award Campaign for Tobacco Free Kid in 2013, and many more. So he is a founder of Maharashtra Cancer Warriors, that is offering voluntary oncology services in 24 district hospitals of Maharashtra. So welcome, Dr. Pankaj Chaturvedi.
So welcome, Dr. P.C. Gupta. He is one of the senior most tobacco control stalwarts in India and at an international level also. So he is director of HILIS, Saxeria Institute for Public Health, Navi Mumbai. He has a Doctor of Science degree in epidemiology from Johns Hopkins University, US. He is a visiting scientist of the Harvard T.C. Chan School of Public Health, Boston. He is an adjunct professor of epidemiology and biostatistics at the Arnold School of Public Health, University of South Carolina, US. He has received several awards, including a Luther Terry Award from the American Cancer Society in August 2003 and Tobacco Free World Award from the Director General WHO Geneva. He is a mentor to us all in tobacco control fraternity. So welcome you, sir.
So I would like to welcome Dr. Ravindra Khewal, who is my colleague and additional professor in Department of Community Medicine and School of Public Health, PGMR Chandigarh. So he's an additional professor of health environment. He has worked for 5 years as scientist in Center for Atmospheric and Instrumental Research in University of Hertfordshire, UK. He has authored more than 80 articles, including original research paper, review, and book chapters, and his articles has been cited 4,500 plus times. His research interest includes monitoring of pollutants, chemical composition and source characterization, health risk assessment, global climate change, and environmental impact assessment. He has received several awards and scholarship in the field of environmental science and engineering, including Environmentalist of the Year 2007 around the globe, and was finalist of Young Scientist Award in 2014. So he will be one of the experts on health environment during this panel discussion today.
So thank you, Dr. Sonu. And so will be this discussion that will be moderated by me and Dr. Sonu Goyal. So I think we can have questions regarding the media initiatives from Madam Aditi Tandon. So, man, how can the media create awareness about the issue amongst the general public and policymakers?
That's a very relevant question, Dr. Rakesh Gupta. First of all, thanks for organizing this seminar and greetings to all my fellow panelists. It's been amazing to listen to everybody who's just spoken, and the overview was outstanding. And as you said, Dr. Rakesh Gupta, the role of media cannot be overemphasized simply because we live in a world where attentions of people and public are fleeting. We are traditionally moving from newspaper spaces to social media spaces. And the role of media is extremely important simply because you see, a lot of these issues are not in public domain at all. Let me confess here that had Dr. Pankaj Chaturvedi, hello sir, how are you? Had he not shared the order of the National Green Tribunal with me, I was not aware of the massive, humongous damage that cigarette butts and bidi butts are doing to the environment. So, as a media person, I do feel, Dr. Gupta, that we need to talk more and more, and that interface between public health experts, anti tobacco campaigners, and the media was never more required than it is required today. What I feel in my own space is that there is not too much conversation happening as much as we need it to happen. For example, we are only at the cusp of this major challenge with respect to disposal of cigarette and TV butts. And the role of media is huge because you see, how did India eradicate polio? We brought in a brand ambassador of the level of Amitabh Bachchan, and there was a major IEC campaign around polio. There was a targeted campaign in respect to the myths around oral polio vaccine. We targeted communities which actually harbored these myths that oral polio vaccines can lead to this problem, can lead to that problem. There were targeted interventions supported by government's IEC campaign and totally amplified by the presence of Amitabh Bachchan. What I feel is, if we can eradicate polio, which was a very tough disease to eradicate, if the world could eradicate smallpox earlier with complete collaboration of society, community, and public health experts, I see no reason why we cannot control tobacco and why we cannot actually attack with equal vigor and aggression the tactics of the tobacco industry. What is happening today is that media campaigns against tobacco are not as aggressive as the tobacco industry's intervention in the youth and the public spaces of the country. I also have often wondered as a media person that why don't we have a very big name talking against tobacco? If Amitabh Bachchan is happy to talk against a lot of other issues, to actually be government's brand ambassador for tuberculosis control, earlier for polio, why can't these big names, for instance, Sachin Tendulkar, for instance, Amitabh Bachchan, these are people who public listens to. I have never ever come to terms with the fact that the government of India has literally struggled with finding ambassadors to speak against tobacco and to speak in favor of tobacco control. And I must congratulate Rahul Dravid, who actually offered his support. And in 2013, as you know, Rahul Dravid was made the brand ambassador for National Tobacco Control Program. So, media, I just want to quickly highlight one biggest public health campaign where media showed how its role can actually change lives of communities. I would like to pay my tributes to the now departed Mr. Harold Evans. He was a British American journalist, and he is an ideal for a lot of investigative journalists in public health across the world. And there is a legend around Dr. Harold Evans that when he was the editor and the reporter for Sunday Times, he went after a very big German manufacturer of a drug called thalidomide. Thalidomide was openly being marketed across Britain by a local company called the Distillers. And distillers at that time was the biggest advertising generator for the Sunday Times, for which Harold Evans was an investigative reporter. However, Harold Evans went to the survivors who had actually, what had happened is thalidomide was being given to pregnant women to prevent morning sickness. But over the years, it was found that these women who were on this very difficult and debilitating drug were giving birth to children without limbs, children who had blindness. So there was a concerted public health campaign through the Sunday Times and Harold Evans leading it against the biggest advertiser of the Sunday Times, the distillers, which was the local marketeer of this thalidomide drug, which was actually a German make drug. And together they all worked and they actually got a law passed in Britain to ban thalidomide. And not just that, there were trusts formed in Germany, in Canada, in Britain, which actually are now taking care of everybody who was affected by this very dangerous drug. Similar and even more debilitating are the effects of tobacco in India. And I think media, if it wants, can play a huge role. And we need to move into the social media space now, because you see, look at the look at the presence of Facebook, look at the presence of Twitter, Snapchat, Instagram. All the youngsters are on social media spaces now, and we will have to think of very innovative ways of advertising and of reaching out to these youngsters against tobacco, against e-cigarettes, against the vaping epidemic through the social media campaigns also, apart from the print and the traditional media where we all actually already have a presence. So that's what I feel, Dr. Gupta.
So,
Aditi is in constant touch with me regarding these tobacco control issues, and thank you for taking up that issue, thalidomide disaster. It was an important issue which was taken up by the media very successfully. So I hope you will be with us on this issue, tobacco product waste issue, and we know you are a celebrity yourself, and
Not at all.
and administrators and politicians, they listen to you. So thank you. So Dr. Sonu, next.
yeah, so thank you, Ms. Aditi Tandon. I think you have very nicely highlighted the role of media, and I think it is quite visible now in the COVID times as we are progressing in this COVID pandemic. I think media has played a wonderful role in mitigating the myths which is really present in these COVID times. So, and as Dr. Rakesh Gupta has said, I think the outcome of this consultation and the discussion during this consultation, if highlighted in the media, will be very crucial. So thank you. And I think you have rightly pointed out not only the role of media, but the role of brand ambassador. And you have highlighted one, Mr. Rahul Dravid. And I think when we'll come to Dr. Pankaj, so we'll have, I think, Akshay Kumar is another one which we used to listen, I think, whenever there is a film which is being depicted, and there are a few more. And I think not only these type of ambassadors, we have other ambassadors which Dr. Pankaj Chaturvedi usually treats. So they are their patients actually. So they are our role models and our real ambassadors actually, which play a role in media. And I think they have played quite successful role in that. So thank you, Ms. Aditi, for playing this important and being a part of this important consultation. We'll come back to you again. Now regarding the environmental issues. So I would like to welcome Ms. Chandra Bhushan and Dr. Ravindra Khewal to answer few queries. First, Mr. Chandra Bhushan. Dr. Chandra Bhushan, sir, we want to know about the first two questions.
Dr. Sonu, Dr. Chandra Bhushan is, I think, a little busy. So I think Dr. Ravindra can go first, and he will join us by, I think, 1 p.m. He will join.
No, I can join now. I have finished my assignment.
Great.
Okay.
Thank you so much.
So, Ms. Chandra Bhushan, I think I just want to know about like this flue-cured Virginia tobacco, about its hazardous role in the environment, as well as what has been done till now, like based on your experience of last 30 years, if you have worked on this tobacco product waste. So what are the current regulations and what can be further possibilities to minimize the tobacco product waste burden on this and on the environment?
First of all, thank you very much for having on this panel, and I would like to thank everyone who is involved for organizing this excellent webinar. First, as a disclaimer, I have never worked on tobacco control. So it would be absolutely wrong to assume that I have any knowledge of tobacco control that I don't have. I have worked on plastic waste and on waste management. So I'm coming to this webinar from the perspective of waste management. And also another disclaimer that, I have heard panelists before me talking about air pollution and water pollution from disposal of tobacco products. I have not worked on that either. So what I'm going to do is to largely discuss the waste issue arising out of tobacco products and how we can find some legal remedy for that. As you know, and I think this has been discussed already, that National Green Tribunal has asked the government to develop a guideline for tobacco butt disposal and BD waste disposal by December this year. And I hope people in the tobacco control industry, in the field had filed a case on this. I have looked at the case and I have also looked at the background document that was submitted to NGT. And I must say that the petitioners had submitted a comprehensive set of data on this issue to NGT. And therefore, despite government saying that cellulose acetate is a biodegradable material, which is quote unquote true, but I'll come back to the issue of cellulose acetate later. The NGT was of the opinion that despite that, there is a case for coming out with a clear guidelines on disposal of tobacco waste products, cigarette and BD products. Now, coming back to the issue of cellulose acetate, while it is biodegradable, the degradability is very slow. And therefore, if we fix a timeline for degradability, ideally speaking, a biodegradable product should degrade very quickly. We call food waste a biodegradable product because within months it can degrade into natural component of the environment. That doesn't happen with cellulose acetate. It takes years for cellulose acetate, if not hundreds of years, that, for example, polyethylene products would do. But it would take at least years for cellulose acetate products, even with certain molecular modification, to degrade. So if that is the case, then in short term, I mean to say in terms of waste management, it is a problem. And I would argue that certain aspect of plastic waste management should come also for management of cellulose acetate. And that's where, while again, legally it is not defined as a hazardous product, we have hazardous waste management rule under which we have defined characteristic of what constitutes hazardous material. We know that nicotinoids are pesticide. We have used nicotine as a pesticide for a long time in this country. In fact, nicotine pesticides have been linked with colony collapse disorder for honeybees in the Western world. In Europe, in Germany, for example, they had to ban all nicotine-based pesticides because it was found to, basically, it was decimating honeybees. So I don't think there is any argument on toxicity of nicotine that exists. What argument could be, and I would like all of you to consider it, that when a tobacco waste is disposed in the environment, for example, in water body, what concentration is there of nicotine remains in the water body. So my suggestion to people who are working on tobacco control, and if you are looking at environmental issues, if you want to link environmental issues as well, then I think you should do some more monitoring to understand what is the concentration of nicotine coming into our environment. I don't think there is such data that exists. Even on number of cigarette butts, I don't think there is any proper data that exists in India. We do know that from road sweeping, and city level data show that that cigarette butts are an important component of road sweeping. I don't think any assessment has been done in terms of beach, how much they are finding. So there is an issue, but I think we can strengthen that issue by doing proper study and research, because I think we are at the nascent stage of discussion in this country on waste part of tobacco. I think we have done very well from health part of tobacco, but environmental and waste part of tobacco, there is a huge gap, and some more study needs to be done before you can convincingly argue that let's bring it in different legal framework of the country. For example, under Hazardous Waste Act, or for example, under plastic waste. I think getting it under plastic waste management is much more easier, or for in Municipal Waste Management Act is much more easier. But if you want to call tobacco waste as hazardous waste, a lot of work is required from Indian perspective, from Indian scenario, before we can argue for it. The last point I would like to make is guideline making is very easy in this country. Okay, a guideline is not a legal document. A guideline is a guidance, and even if NGT has directed Central Pollution Control Board to develop guidelines, we will have to see what is the legal backing for that guideline. We publish guidelines, dime a dozen in this country for everything. So also, what is the outcome of NGT in terms of what would that guideline contain, where they are going to place it legally? These are going to be an important consideration for all of you. Thank you very much.
So thank you, Dr. Bhushan. I think you have very nicely emphasized upon data, the studies which should be done. More studies should be done on this particular perspective if we want to be very strong in the court of law. So I think going further on this aspect, I would like to ask Dr. Ravindra Khewal, have you encountered some sort of studies which Dr. Bhushan has pointed out about its environmental impact of tobacco product waste on marine life, or about the plastic pouches, about the BD and cigarette butts, the amount of it, the quantum of it, and the environmental pollution which it causes? So, Dr. Ravindra?
Thank you, Dr. Goyal. First of all, I would like to appreciate for initiating this discussion and consultation, because it is very important that we highlight the tobacco product waste. So I will come first to the first question, which is there actually, means how it is hazardous to environment. So we all know about that more than 7 million deaths we can attribute to the tobacco and associated health issues. But when it comes to environmental, probably before I come to the study, I would like to explain that we don't understand that, oh, it may also cause harm. Let us understand, when we smoke, it causes emissions. And these emissions have the most toxic substance inside. You name anyone. Polycyclic aromatic hydrocarbon, you name PAH means, or you name DDT, toxic metals, all are there, as highlighted in the first slide also, where 4,000 non-toxic chemicals were there in this. So we say that roughly, if we talk about Indian terms, 10,000 million cigarettes are there, and which could generate around 7,000 tons of carbon dioxide, apart from these toxic chemicals. So there are toxic substances in it, there are greenhouse gases in it, so the emissions are affecting our environment. Coming to the next point, you also highlighted that cigarette butts and other tobacco product waste, probably in count, they are having a major impact. But it's not the count, basically, it's the toxicity which matters. So as I highlighted, they have several toxic compound, non-toxic compound, and they might be higher in number and they might less in volume, but despite that, they might be severely toxic substance. Then when we talk about tobacco cultivation, we need to understand our curing process, basically, that cause deforestation, that deplete soil, loss of soil nutrient, And when we come to this, we also use agrochemicals. And when we use agrochemicals means pollution. So that is again become a cycle of this pollution. Now we need to think about the as a life cycle if we are coming to the manufacturing process. Means we know that the manufacturing process, it is a red industry, means categorized as red industry. So it is producing nicotine, and nicotine is known for its toxicity. And apart from it, we need to understand that when the cigarette is a red industry, the BD industry is a home based industry, and there is no regulation. So their waste can degrade or affect the local water bodies, the local soil, or you can say the air. So we need to think about how we can really work upon this. I will touch on that also later on. But India is committed to a framework for you can say tobacco control, and under the Article 18, we are working in this direction. And as you asked some legislation part actually, so I would like to highlight, I think people are aware that in September in Chandigarh, there was a plastic bylaws consultation with public was there. And I think there was no discussion about the tobacco you can say waste and tobacco packing waste. So this shows that yes, there is a means we think only other industry, but we are missing a major contributor. We all know that plastic waste, they were revised and accepted again in 2016, then 18, and as per the law of plastic waste 3O basically amendment, the plastic waste containing essential ingredient as highlighted by the first presenter, having you can say polyethylene, vinyl, low density, or there are also multi compound, they are known as, and they need to be recycled. So for this multi-packaging basically product, they need to be collected by the those who are producing it or those who are exporting it. And this is all very well defined in the plastic waste law. Either we are looking the rule 9, you can say 2, or there is another law we can say which is highlighting. So we can say this, there is a rules and there is a guideline regarding this. Only thing is that we need to implement, as Madam Aditi also highlighted that implementation challenge is there. Similar way, my colleague who is working in the area of environment, Mr. Chandrabhushan, also highlighted. So implementation challenge will be there because if you look at the plastic waste, there is no proper data. We have done many studies for Chandigarh and several for Delhi actually. But what we can say that these products could make up to 7% of the plastic waste, which should not go to the air actually. 94 is, we can say up to 93, 94 is recyclable, but 7% is which is non-recyclable and will only impact our environment, or it is non-recyclable. So there need to be a policy, and under the rule 9I basically of biomedical waste 2016, it is defined, and the producer is make responsible, and of course they have the opportunity either to collect it individually, or they can also collaborate with urban local bodies or authorities, or including other organization, to ensure that the waste they are producing is being collected back. So I will answer a few more questions. In the meantime, Dr. Goyal may. Yeah.
Yeah. So thank you, Dr. Ravindra. We'll come back to you again. So we have with us Dr. Jagdish Kaur, who is Regional Advisor at Tobacco Free Initiative at WHO Regional Office for Southeast Asia, New Delhi. So she's a medical doctor, public health and a public health expert, having intensive experience in tobacco control. Before she was appointed as a regional advisor in WHO, she was working with Ministry of Health and Family Welfare, Government of India, where she has spearheaded various initiatives in national tobacco control programs. And she was involved in making that national tobacco control program policies and legislations. and also other programs such as mental health, oral health, healthcare of elderly, deafness, telemedicine, digital health, and many more. And she has published, besides being an implementer, she is an avid researcher, have published various research papers in various journals, developed various chapters in training modules, and were instrumental in making various guidelines and contributing to various books on tobacco control and non-communicable disease. So, madam, we welcome you in this consultation. So I think you have listened to some of our experts speaking on this tobacco product waste. So, ma'am, what is your as well as WHO views on this tobacco product waste?
Thank you, Dr. Sonu Goyal and the organizers. And I think, first of all, I should congratulate you all, the union, Cypher, for organizing this meeting, because this is very important issue of tobacco control. And generally, when we talk about the health aspects, economic aspects, and other aspects, we forget about environment. And these days, when we talk about climate change and other environment aspects in general, so tobacco plays a very important part. So, as all of you who work with tobacco control are aware that WHO Framework Convention on Tobacco Control, FCTC, which we call, this treaty came into being in the year 2004. And this treaty, being a very comprehensive one, it deals with all the demand and supply reduction issues concerning tobacco. So environment is also an important issue. So specifically, if we talk about how WHO, FCTC, which is now having 182 parties, so 182 countries in this world, they are parties to this important convention, and if all of them take action which is related to environmental impact of tobacco product waste, then there can be a substantial change. But it is important to have a look at that. So basically, how FCTC deals with the environment, then there are various articles in the treaty. So Article 18, which talks about protection of environment and health of persons, that is specific to this issue. But then there are other articles in the treaty which are related to this directly or indirectly. So if we talk about Article 5.3, then there are, that is with the journal obligations, and obligations of tobacco industry also makes part of that. So under Article 5.3, we can talk about, extended producer responsibility and product stewardship program. Because tobacco industry makes a lot of greenwashing claims. They say that our products are, I mean, they're not harmful to the environment and all those things. So that can be dealt with this article. Then we have Article 8, which is protection from tobacco smoke, second-hand smoke. And then we have Article 9, which deals with regulation of contents and emission of tobacco products. Then we have Article 12, which deals with the education, communication, training, and public awareness campaigns. We have Article 13, which talks of tabs, tobacco advertising, promotion, sponsorship. We have Article 17, which is alternative activities to tobacco production. So all these articles, and then also Article 19, which is in general liability. So we can hold tobacco industry liable for this environment damage because of the tobacco product waste. Then is Article 20, like other speakers who spoke before me, they were also speaking about, we need more research, we need more surveillance, we need more of exchange of information. So that is dealt with by Article 20 of the treaty. And then there's Article 21, reporting and exchanging of information. So all these articles under WHO FCTC, they can be used to deal with this issue, which is a very important issue, I think, from all points of view, directly or indirectly it affects human health also. And then there are so many other repercussions of this. So WHO also came out with a report, Tobacco and its Environmental Impact, an overview in 2017. So that year, the World No Tobacco Day theme was on tobacco and development. So as part of that, like how tobacco affects the environment also, we took out this report which talks about in detail how tobacco affects and not only tobacco products waste, because like here we are specifically talking about tobacco product waste products, how it affects But then right from, the tobacco is produced, it is grown, then it is manufactured, it is cured, it is distributed, it is consumed, it has effects on the environment right through that. And then there are tobacco product waste when the products are consumed. And specifically, like Dr. Hana and other people, they highlighted that how smokeless tobacco, which is specific to this part of the region, I would say, like with India, we have Bangladesh, Myanmar, Nepal, Sri Lanka, where a lot of this Bhutan tobacco products are consumed. So the packaging, so huge, the solid waste is generated because of that. And we also, listen to this that, Supreme Court direction in 2010, and then nothing happened, and there was this law in 2016, plastic waste, and but nothing happens. I mean, it's taken so casually. I mean, in spite of now being the, if the highest court is saying, and if there's a law also, then if nothing happens, that's I mean, a very serious thing. WHO says this guidance which we draw, because countries who are the parties to the convention and who have ratified the treaty, so it is their obligation to make those laws, to enforce those laws, and come out with such regulations so that we protect our environment from tobacco product waste, which is a big concern, in a way, like we have all spoken about. It's hazardous, it is dangerous, it contains so many chemicals, as tobacco contains, smoke itself contains 7,000 chemicals, and many of them are carcinogenic. And then plastic has its own damage, which it causes to the environment. So these things are, we need to, make people aware, make policymakers aware that how it is damaging the environment, and how they should look at it, and how they should come out with the legal provisions or regulations, and then enforce those. Not only that, we have, like we said that we make guidelines, but then they are not obligatory. But when there are laws, then it is our, duty to enforce those laws in letter and spirit. So I think with the WHO's guidance, with the WHO support, and with the technical material which we provide from time to time related to various articles, governments, they need to be as party to the convention. And one comment last I would like to make on, people said that, Aditi said, I think, about Amitabh Bachchan not coming forward with, uh, tobacco and other things. See, it is very difficult to bring in people for tobacco control as advocates or as ambassadors, because when I was in the ministry, we had high time, finding a person, and then Rahul
So I think we have lost contact with Dr. Jagdish. Dr. Jagdish?
So I think there is some internet connectivity issues, but I think Dr. Jagdish has put her point very nicely, that there are sufficient sections in our Framework Convention for Tobacco Control (FCTC), which clearly states that we can sue tobacco industry based on various sections of FCTC, for which India is a party to it, along with many other countries. She has also highlighted a concern that despite a lot of court orders which has been there, Supreme Court orders which are there, there is no action as such which has taken place in 2011 on this particular issue. I think these are the two things which very nicely highlighted by Madam Kaur. So, Dr. Rakesh, you can continue asking with the human rights issue with Dr. Pankaj Chaturvedi.
Okay. So, Dr. Pankaj, can you just comment upon the human right violation and how the human right law can be leveraged to promote governments to implement FCTC and anti-tobacco and other related laws? And what are the human right violation in tobacco product manufacture? and environmental depletion because of tobacco product waste. Dr. Pankaj.
Yeah, so thank you, Rakesh, and thank you, Sonu. That was a wonderful start to an important session. And as you know, we had filed our petition in the National Green Tribunal, and we recently got the order. And that order shows that we could prove for the first time that indeed tobacco is not only toxic to the consumer, but it is toxic to the environment and it is toxic to the flora and fauna of the country. So originally, our petition was three fronts. It was to label cigarette butts as or BD butts as concentrated toxic waste, and the second thing, what we wanted to highlight that butts are causing loss to property and loss to human lives. And reason we gave was that in 2010, almost 60 acres of forest land was depleted because of careless throwing of the cigarette butt. And in 2013, in Hyderabad, of the 390 acts of fire accidents, 182 were because of cigarette butts. So when we talk about the human rights, what we do not realize that people, when they carelessly throw the cigarette butts, it leads to huge loss of lives and property, and that's an important issue that we need to deal with. And the third component to our petition was that tobacco cultivation, it leads to soil depletion, deforestation, and loss of nutrition of the soil, and excessive agrochemical use because fungicides, pesticides, weedicides are used for tobacco cultivation. And certainly when we are talking about the curing, we are talking about the pollution to the environment. Now, just to give you the sheer number, because we come to the human rights, and then when we see like flue-cured Virginia tobacco in India, as per the Central Tobacco Research Institute, Rajamundry, we produce 3,000 lakh kg of FCV per year. Now, to cure 1 kg of dry tobacco, we need 8 kg of forest wood. And if it is not a dry tobacco, because sometimes because of the weather condition, the tobacco crop is little wet, it can require up to 20 kg of forest wood for curing. That means multiply 3,000 lakh kg per year with an average of 10, we are talking about 30,000 lakh kg of firewood being utilized for a crop which is killing people. And in Karnataka alone, we have around 8 to 10,000 lakh tons of wood being used. In fact, Forest Department of Karnataka in 2010 gave a report that between 2000 and 2009, there was a 10% depletion of the forest cover. And similarly, the Institute of Forest Management, Bhopal, it showed that in between 1962 and 2002, 680 square kilometer of scrub forest was destroyed. So what I am trying to say that very carefully tobacco industry and we as tobacco control advocates only focus on the health aspect and human right aspects of the individuals who are using it. What we are not able to portray that it is a very minuscule component of the entire tobacco epidemic and tobacco burden. What is more important is the harmful effect of environment, and that is why I petitioned the Parliamentary Committee on Forest and Environment. 30 members of parliament, I gave the deposition in front of them. There is a report on the website, on the Rajya Sabha website in 2016 May, which for the first time the parliamentary committee, which is the highest body in India, shows that there is a severe environmental impact of tobacco cultivation and therefore something has to be done. And when I say environment, it is affecting the health of every citizen of India, every citizen of the world. Now, second component that is very important and we must highlight that tobacco is not only harmful for the tobacco user, but even the farmer. And we have raised this issue with Ministry of Agriculture. I was personally there in CTRI Rajamundry trying to convince the farmer. There is something called green tobacco sickness. We know that nicotine can be absorbed when somebody handles the crop with wet hands. And when you do that, it causes acute nicotine toxicity. And of course, there are nitrosamines can also come through the skin. So farmers have to be realized that though it is a cash crop, but actually it is very hazardous for them and their children. We are talking about people not using tobacco. Imagine the farmers, their family, the laborers working in the farmland, the BD workers, they live with tobacco crop 24/7. And we need to make them understand that basically tobacco farming is a modern day slavery, and we need to bring them out of that slavery. Similarly, because tobacco is a cash crop, farmers are giving up the paddy cultivation. They are giving up the vegetable cultivation, and they are moving to the tobacco cultivation, and they are clearing the farmlands because they want, once you sow a tobacco crop, it sucks out the nitrogen, phosphate, potassium, and that crop is not usable for the next cycle of the crop, and therefore they have to go to the new farmland. This is causing food insecurity, and food insecurity means that again it is affecting the health of the people living in that vicinity, and again it amounts to human right violation. Manufacturers should realize that as per the Ministry of Environment, the tobacco manufacturing comes under the red category. That means it is a hazardous industry, and therefore workers working in this industry, they also face several challenges. So at the end, I would say that yes, 13.5 lakh people who are going to die, it's a serious human violation. Millions of tobacco farmers who are engaged in tobacco cultivation, it is a human right issue for them because they are cultivating a crop that is almost giving them health hazard apart from giving them money. Then certainly the carbon dioxide emission and the curing, which leads to what was said before, greenhouse effect. So looking at that entire tobacco cultivation and tobacco business, we as tobacco control advocates have to ensure that we highlight this issue, and that is where I would like to congratulate both of you for bringing this issue on board. Thank you so much.
Thank
Thank
you,
you.
Dr. Pankaj, for highlighting the human rights issue, and some of the queries at serial number 4, they have also been answered. So Dr. Sonu, so rest of the queries you can just carry on at serial number 4. I think Dr. PC Gupta and Dr. Amit can answer those queries.
So I think I will like to invite Dr. PC Gupta on extending the talk of Dr. Pankaj Chaturvedi, who has very rightly pointed out that tobacco is not only harmful for users, but also all the stakeholders who are involved associated with it. So I think just to extend this, Dr. Gupta, just want to know about how tobacco farming is causing food insecurity and burden to our economy. Dr. Gupta, are you with us? Sir, you are muted.
Yes. Am I audible now?
Yes, sir.
Okay.
Perfect.
Yeah, first of all, I'd like to congratulate the organizers for organizing this particular session, which has gone on very well so far. And I would like to be very brief because I think a lot has already been said. We did not really focus much on environment for a long time as public health people, simply because the effect on human health was so toxic, so severe, that most public health people didn't even think of environment. Now, in India, Dr. Pankaj Chaturvedi, who has handled tobacco control, who has looked at it from many, many different dimensions and many angles, child rights, weights and measurements, many other angles, he suggested that environment is a very big issue and we should do something. And that's how he persuaded me to look deeply into the research on toxicity and toxic waste effect of tobacco. And cigarette butts are called toxic waste dump in literature. That's how they are. And there is plenty of studies which Dr. in fact Singh was asking for. Those are available, but those are available from Western countries, the USA and other countries. Unfortunately, from India, I agree with him that those studies are very few, and for Indian regulations, we might need those studies. I will just emphasize, would like to point out one thing, that the industry, we have to remember, that is always very much ahead of us. And right from the day when we started thinking about lung cancer and health effects of tobacco, the industry always knew and was ahead of us. So to counter the idea that tobacco affects health, it was sponsoring all the sports competition in very big way. And we know that until few years back, cricket was completely sponsored by tobacco industry in India. Now we are thinking about environment, okay, a lot, and the impact of tobacco on environment. Now, who is projecting in India itself as the most environmental friendly and caring company for environment? I mean, that is ITC, receiving all kinds of awards for environment and projecting itself as environment friendly, environment caring industry. So, when we talk about environment, we have to remember that it is not that only we are talking, they know about what we are going to talk and what we are going to do. Fire, Dr. Pankaj Chaturvedi referred to fire. Now, fire is a very emotive subject, we know that, for everybody. So when we say that cigarette butts and industry is responsible for causing fire, it is because it is treating cigarettes paper in a very special way that when you take it out of mouth, it doesn't get extinguished. It keeps on lit. And that is so that it burns faster and industry sells more cigarette. But also the effect is that if you throw the cigarette, it is lit and it can cause fire. And very large number of forest fires are caused by cigarette butts. And when this data gets published, Philip Morris published a rejoinder, that standard kind of a thing, that forest fires are there even when there is no cigarette smoking. So that is the kind of level. And even as Dr. Chaturvedi pointed out, home forest fire or not forest fire, home fires, where people lose their lives, are also many of them are caused. In fact, in USA, about 25 to 30% of fires in which humans have lost their lives were caused by cigarette butts. And then you sort of surprised that why there has not been that much outcry against this huge loss of life. Because after all, there are fire people, fire departments, which stake their life to save people from fires, to go into fire, and why there have been not a protest. And when we looked at it deeply, public health people, it turned out that the cigarette companies were the largest donation, were giving largest donation to all the association of firefighters. So obviously this issue didn't come into fore for a long time. So there are all these issues, many issues, we have to always remember and think that industry is ahead of us and we have to, how we can tackle it. There are concepts, of course, for tackling. There are extended producers' responsibility and extended stakeholders' responsibility. There are laws. In fact, from what I understand, the law that is there in Maine, state of Maine in USA, that is most effective, very well drafted law for treating tobacco product waste. So I think there are lots of resources and lot of work still needs to be done, and a lot of care needs to be taken in pursuing this particular harm from the tobacco products. So thank you all very much. Thank you, Sonu, and thank you, Dr. Gupta.
So thank you, Dr. Gupta, for very nicely highlighting another dimension of this tobacco product waste that is linked with all type of tobacco, that tobacco industry. So I think we need to take this issue right up front, and we have initiated this consultation quite ahead. So we hope that we could get recommendations out of this consultation. And we really congratulate Dr. Pankaj Chaturvedi, who have filed this case at this particular very pertinent moment. And I hope that government will file that reply and will make a sort of a law pertaining to this particular issue. So I think when we come towards the law, So I want to ask Dr. Amit Yadav that there are multiple laws and has been discussed in this forum. So what are the 3 or 4 laws which are really implementable and which we can really convince the government that you can follow these particular, we can frame these particular law against this tobacco product waste? Dr. Amit, you are muted.
Saurabh, can you change the slide?
Yeah, hi. Thank you, Dr. Sonu and Dr. K.S. Gupta once for organizing this very important consultation at this very important juncture when we have this NGT's order to take these things forward. And I think Chandrabhushan ji has very rightly said that we also need to look at the distinction between guidelines and law. There are guidelines by the food safety departments which actually have legal binding in terms of if you violate the guidelines, the provisions of the law applies. So I think if these guidelines are in that nature, then they are good. I think the plastic waste management is our immediate recourse, which in terms of putting in there so that like the gutka pouches or plastic pouches, they have been banned under the same, and the cigarette butt also contains plastic, so that can be banned under that. However, I think in terms of, and I was discussing this with Chandrabhushan sir, I was saying, when we are talking about any alternative and or prohibiting plastic, so we should not end up using product which are non-biodegradable. So in terms of, instead of plastic, the gutkas, they are packaged in metal or non-degradable items, then it becomes really more burdensome. So I think those things need to be taken. As I think you would have also seen, all of the I think panelists have seen the in terms of draft discussions on recommendations and the laws that we can use. So I think another important thing in India is that the tobacco products per se are being regulated under COTPA. So when these products are regulated under COTPA, so from manufacture to their end, they can come under within the ambit of the in terms of COTPA. And as present, because there is no express on waste disposal under COTPA, I think by regulation in terms of one is minors protection, so under section 6 or under section 5 as promotion, because cigarette butts, littering of cigarette butts also would amount to in terms of a lot of people being enticed that okay, so many people smoke, so it might be normal to smoke. So that is another way. And even in section 7, when we it is normally for selling of tobacco product, but I think disposing. So I think so COTPA could be amended or regulations could be formed. One is regulations we should look at, because amendment takes more time, but I think eventual goal should be amending. One of the suggestion was also that we could also work on a completely, I think Dr. Prakash Gupta has shared a draft legislation which is being discussed outside in terms of in the Western countries, that how tobacco product waste could be managed in terms of from legal perspective, and completely defining them, and how those will be the responsibility of manufacturers, distributors, retailers to collect them and to dispose them well. Dr. Jagdish Kaur was suggesting about using FCTC, and I think one of the areas where FCTC also talks about proper disposal or environment friendly disposal of tobacco products is Article 15, which talks about illicit trade. So whenever these tobacco products are captured in the illicit trade, they need to be disposed in an environment friendly manner. I think that should be extended to tobacco product waste as well, as part of the regulations under environment protection law. So that is, I think, in terms of immediate recourse that I see. However, I also agree, as all of the panelists have said, that we should look at the industry itself. And as Dr. Gupta said, 5.3 becomes very relevant because the industry itself is there everywhere. You are funding environmentalists, you are funding fire department associations. You are actually, in terms of keeping all the stakeholders who are affected on your side. So I think we need to get these people to our side and talk about it from tobacco industries from start to end. From they need paper, so for which they cut trees. They need woods to cure the tobacco, and once they in terms of sell the tobacco, people are affected, and once they dispose, again the people are affected. I was just looking at CTRI's website. It says they use about 42 lakh, 4,20,000 acres of land to produce tobacco in India. And if I look at simply the yield of wheat in India, it is about 2,600 kg per hectare, and if you multiply it, it's about more than 1 billion kg of wheat that can be produced in the land that tobacco is produced. And when we talk about global food insecurity, and Dr. Pankaj has very rightly said that we need to look at these aspects, and we need to talk about it. I think we should we should also put the minors and these issue wise, we should need to put these issues in the center. We should put minors in the center. They are the biggest victim of tobacco industry, and as JJ Act has created huge penalties, so we should look at even juvenile justice in terms of in our arguments. We should look at Drugs Act, NDPS Act. All of these are listed. Even the penal code itself is very important to look at in terms of causing nuisance and in terms of affecting the water bodies. So IPC itself is very clear about it. So whoever is affecting water bodies and polluting water bodies is punished. One thing I also wanted to come back here, because we were talking about in terms of liabilities. So Article 19 already, Dr. Kaur told about Article 19. I would also talk about the judicial stand in our country. NGT has already now said, please prepare guidelines. Supreme Court has already said that anyone who is preparing, in terms of manufacturing any hazardous product or keeping any hazardous product, he is liable absolutely for the harms coming out of its product. So I think let us say, even if we say voluntary non-fit injuria for person who is using tobacco, which is again a very wrong argument, but just for the sake, if we agree that that's there, but then the waste product is eventually tobacco industry's gift to the people or to the environment, and they should be held absolutely liable for it. And I think there is this tortious liability claim against tobacco industries for polluting the environment. So that I think needs to be taken up, and I think we should have petitions across country, not only, let's say, after this NGT order, we should also have local municipal corporation filing petition against tobacco companies, saying that all these municipal waste that they are collecting, it is actually supposed to be collected by the or managed by the tobacco industry. So I think, so those are some of my observations, and I think if more comes, we can take that. I think many of the issues have already been discussed, and which is taken up. And I think another last point maybe I can make is the municipal laws and the panchayat. I think at the local level, all municipal corporations, they have under the constitution legislative rights. So they have legislative rights to, in terms of make rules for environment protection, health and environment protection. So they can come up with their regulations if we have trouble at the state level and at the national level, and and even the panchayats have the in terms of legislative power to protect water bodies, because eventually all the BD butts and all the spit of tobacco spit and tobacco sachets, they are all going to the local ponds and local lakes, local rivers. So I think they have also the rights to ban all these products and call for their proper disposal. And we need to, I think, should look at those different aspects.
Thank you, Dr. Amit, for highlighting various laws which can be framed for dealing with this tobacco waste. And I think we have n number of laws which can be done. And I hope that in subsequent course of time we have strict laws which can be framed in our country. So I think we have discussed a lot of issues, right from the environmental aspect to human health aspect to legal aspect of tobacco product waste. So now we have few queries which I think already has been answered right now, because these queries were asked quite before in this webinar. One was by Mr. Sanjay Seth, so who has said that excellent points, Dr. Chandrabhushan. There is a big gap between guidelines and the law. However, do you think there is sufficient evidence now for serious research and debate on this issue? So I think Dr. Prakash Gupta has already pointed out to some extent that more research is required. We don't have much data or research on it, on the subject, and a few research has already been pointed out by our experts here. And then Dr. Bishwaranjan Purohit from Odisha has pointed out that how can we make the tobacco product waste more accountable through packaging industry for making environment friendly packaging, as the small pouches create much problem to the environment and not recyclable too. So I think again this point was quite highlighted, not only as a public health menace, but also how we can deal that thing legally by Dr. Pankaj and Dr. Amit Yadav. So I think there were a few more queries which were there in our chat section on YouTube, but they have already been taken up. So now I'll hand over to Dr. Rakesh Gupta for proceeding further.
Thank you, Dr. Sonu. So there are some questions actually. This is an important question which was asked by Dr. From Sharing, Dr. Sharing from Salam, Bombay. So she said that there is a company called Code Effect and claims to promote Swachh Bharat Abhiyan by collecting and recycling cigarette butts. The butts are treated for about a fortnight and mixed with cotton to make a material which is being used to make soft toys and cushions. Even ITC and Marlboro, they are supplying their rejected products to Code Effort. Can any chemical treatment make these butts full of toxins to be safe enough to be used in making soft toys for kids? So I think Dr. Ravindra Kheval may be able to answer this question. Dr. Ravindra?
Sir, could you please repeat the question?
Actually, there is an issue that the cigarette butts, they are being collected and they are being converted into making soft toys and cushions. So can any chemical treatment make these butts full of toxins to be safe enough to be used in making soft toys for kids?
Thank you. Actually, we need to understand that these buds have some plastic material and other substance which can be used to make toys. But the process need to be examined before we comment, means have they completely removed the toxic chemical and then making it. So, but as of now, I think considering the safety of the children, I feel the process need to be fully examined and then only we can comment on this.
Okay, I think maybe the pollution control board may be able to answer this question better. So I think we can direct this query to some person from pollution control board. So now I think we should end the discussion session. Because
maybe any expert in this panel, maybe if they have read about this, so can
Dr. Pankaj may be able to answer them.
So Sonu and Rakesh, please understand that cigarette butts are concentrated toxic wastes, and they have been proven not only by the recent NGT order but multiple international studies. And if we are trying to do chemical treatment and processing of these cigarette butts, then the cost has to be humongously high. And therefore, this will never be commercially viable to utilize this. So we have to be very careful. Rather, at the outset, we should not allow such things to happen unless proved otherwise.
Yeah. Thank you. I think
Dr. Pankaj has answered the query well. So, Dr. Sonu, can we wind up this discussion because we are already getting late? And now I'd like to invite our guest of honor, Mr. C.D. Singh. So, Saurabh, can you display the slide? You can skip this. You can skip this. Yeah. So, Mr. C.D. Singh, he is IFS officer, additional principal conservator of forest, Ministry of Environment, Forest and Climate Change, regional office in Chandigarh. He is a professional forester born on AGMUT cadre with 33 years of field and administrative experience in central government and various state and UT governments. He has worked as DCF in Andaman and Nicobar Islands, Deputy Director in Forest Survey of India, DIG Forest in Ministry of Environment and Forest, and presently he's working as regional officer in the Regional Office Chandigarh. He has notable experience in the field of Forest Conservation Act 1980, environmental management and pollution control functions, and he has initiated an innovative standard operating procedure for monitoring of compliances of environment clearance conditions given by the ministry and sensitized the forest departments on inclusion of chapters on agroforestry and interface activities to suit local factors in the management plans. So, Mr. Seal Singh, so you're welcome, and we are waiting for your address.
Thank you, Dr. Gupta. I congratulate Dr. Sonu Goyal and Dr. Rakesh Gupta for organizing such a beautiful webinar on very relevant topic. We have in the professional forestry treating cigarette butts and lighted BD butts as a hazard, as they were the one of the main reasons for causing forest fire. A huge amount of human power as well as financial expenditures are incurred by those states and forest departments which are in primarily in deciduous and dry deciduous region. Majority of the fires are being caused by butts and cigarette butts and BD butts. And we used to assign the reason to the carelessness of the smokers, lack of awareness on the part of smokers. Every year, every division in deciduous and the dry deciduous region, every range employ people, 4 to 5 people, just to check whether anybody is throwing a BD butt or cigarette butts in the forest or along the roadside, which may turn out to be a huge fire, which has already, ill effects have already been highlighted by our speakers, panelists. It's good that we have initiated the industry focused attention. The various components in tobacco waste products such as plastics and other tobacco products were being dealt under different acts and legislation. But industry specific consultation after this NGT order has begun. It not only covers the tobacco and tobacco products, ill effects of tobacco and tobacco products, but also the tobacco product waste as an environmental damaging material. A lot of good discussion has taken place. I congratulate all the panelists who have given good input. And I thought first that it is an initiation on behalf of Central Pollution Control Board when I have been invited in this webinar. But as pointed out by Dr. Ms. Tandon and Dr. Pankaj Chaturvedi, it has been the initiation of Ms. Tandon that such webinars should be organized. And my request would be a very good discussion has taken place. A lot of input have come. Please share whatever the outcome is coming with the CPCB so that a guideline as directed by the NGT can come up in next few days. I also, since there is a control of pollution division in the ministry, I am not directly dealing with the CP division, which works in tandem with the CPCB. So it would have been much better if somebody from CPCB or the control of pollution division in the ministry is associated with such webinar. We are in the field and the field activities are concentrated broadly with the forest protection, forest conservation, wildlife issues, and other environmental factors, monitoring of conditions. So policy issues are looking by policy issued or issues are looked after by the ministry, CP division, and CPCB with the CPCB. The outcome, already there are many rules as highlighted by Dr. Ravindra Khewal, Dr. Jagdish Kaur, Dr. Prakash Gupta, Dr. Chandra Bhushan. So the guidelines can vary well. Even if the guidelines are coming, these can be enforced by such rules with slight modification in the rules in various action rules and guidelines which are already existing. So a beginning can be made. I am thankful to the organizer that they have given me the opportunity. It's a new subject for me. That TWP is one such field which is being taken as a in toto as a environmental polluter. Though in bits and bits it has been covered earlier, but this is a good initiative, and I. Special thanks to Dr. Pankaj Chaturvedi, who has taken the initiative to take the matter to the court and come up with the direction from the NGT. I hope that this webinar and the outcome of the webinar will be helpful in framing the guidelines in near future. Thank you. Thank you very much.
Thanks a lot, sir, for joining us and for your valuable suggestions. And actually, we wanted to finalize the recommendations. Some kind of finalization would have been better. But now, since we are already late, so we'll be sharing the draft recommendations with all of you. Yeah. And so that it can be finalized and sent to Ministry of Environment and Forest and to the Central Pollution Control Board. So, sir, we invited chairperson Punjab Pollution Control Board, but unfortunately he was busy somewhere else. So at the last moment he had to join some other meeting. So, but we will share the recommendations with him also. So I think we can move on to Mr. Arun Verma. He is Director of Finance and Operations of Cypher. He is an electrical engineer by profession, having master's degree in power systems. He is fellow of the Institution of Engineers and fellow of Indian Council of Arbitration, and formerly Director Distribution, Punjab State Power Corporation, Director UHBBN, Director HVPN, Director HPGCL, and Managing Director of Dakshin Haryana Power Corporation. So he was also invited by the World Bank to share the experience in sizable reduction of carbon footprints through introduction of high voltage distribution system in agriculture sector in the state of Punjab. So I'll request Mr. Arun Verma to propose a vote of thanks. Arunji, please unmute yourself.
Yeah, next slide, please. Thank you, Dr. Rakesh, for this introduction. Very good afternoon to everyone. It is an honor for me to express my gratitude to everyone for being an indispensable part of this virtual consulting. At the outset, I thank our guest of honor, Mr. C.D. Singh, IFS Additional Principal Conservator of Forest, Ministry of Environment, Forest and Climate Change. Now he is in the regional office, North Yon, Chandigarh, for accepting our invitation to grace the occasion, even on the holiday. Sir, we are really enlightened with your knowledge of the subject and your benign presence. Next, please. We are also extremely thankful to our honorable expert panelists who readily accepted our invitation and request to be the part of this awareness consultation on Sunday after a long and very hectic week. It speaks loud about their passion, concern, and commitment to the cause of environment and public health. I would like to thank Ms. Aditi Tandon, Special Correspondent at the Tribune, Dr. Amit Yadav, Senior Technical Advisor, Tobacco Control, the Union Southeast Asia, Dr. Jagdish Kaur, Regional Advisor, Tobacco Free Initiative, WHO Regional Office for Southeast Asia, Professor Dr. Pankaj Chaturvedi, Deputy Director, Tata Memorial Center and HOD Department of Head and Neck Surgery, TMH Mumbai. Dr. PC Gupta, Director of Health and Shiksha Institute of Public Health, Mumbai. Dr. Ravinder Khaiwal, Additional Professor, Department of Cumbri Medicine School of Public Health, PJMIR. Mr. Chandra Bhushan, President and CEO of iForest India. Professor Dr. Sonu Goyal, PJMER, Dr. Rakesh Gupta, President Cypher, Dr. J. Rana, Deputy Regional Director, the Union, for their contribution to the consultation. A special thanks to the organizing team of PJMR and Cypher for their unflinching support and coordination. Our heartfelt thanks to our audience on the YouTube for active participation. With these words and a kind message, now we move to the end of the consultation. Thank you once again to each and everyone.
So I'll request all of you to just switch on your video so that we can have a group photograph, please. So Saurabh, can you remove the slide and we can have a group photograph?
And we have with us Mr. Rajiv Sharma also, who is a SCE from Punjab Pollution Control Board, because our chairman has to leave, has to join some other meeting. So he has deputed Mr. Rajiv Sharma for it. So he's in Zoom, this thing.
Okay,
Mr.
thank
Rajiv?
you, Mr. Rajiv Sharma, for joining. Thanks a lot. So can you switch on the video? Can all of you switch on the video so that we can have a good photograph? Yeah, Rajiv ji, can you switch on the video? And Akanksha? Akanksha, Saurabh, all of you, please.
Who is clicking it?
I am also clicking it and Gurleen can do it.
स्क्रीनशॉट भी ले सकते हो उसमें जो इसे फोटो जो उस पे आता है ना
वो आता नहीं है
राजीव 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 करें
Yes, yes. Yeah, I have already done. Yeah.
Okay. You've taken that shot?
Yes.
Okay, so thanks a lot, all of you.
Thank you, sir. Thank you so much.
Thank you.
Okay, thank you. Thank you very much.
Thank you, sir.
Thank you, everybody.
Thank
you, sir.
Dr. Rakesh. Thank you very much.